Hello, I'm Martin, lead analyst at Healthcare Business International, and I'm here at our 2026 conference in Paris with Emmanuel de Geuser, who is CEO of Vivalto Santé, which is one of Europe's largest pan-European private hospital groups, present across 7 European countries with 100 facilities in total. What's been the biggest strategic lesson for you expanding internationally across Europe?
For Vivalto Santé, expanding into 7 countries has taught us at least 2 main important lessons. First, having a diversified portfolio across countries was a good way to safeguard our ability to reach our commitment towards our shareholders. Because this is a kind of risk management portfolio where if in a country you have some difficulties, you can balance it with better situation in another country. So it's by far easier to be in 7 countries than in just 1. The second element is managing hospitals across diverse environments has enabled us to explore a wide range of business models, which means that it has been an opportunity to provide inspiration for our people and to share what could be best practices, what could be things we can learn from one country to the other.
Do you have any examples of such best practices?
A lot. The easiest one is about procurement. Working on procurement together was the best way to see, okay, how can we take the best of each country in terms of negotiation, in terms of ways of deciding of what should be the good articles, how to manage it with the doctors, because the doctors are a key partner in the process. So, it was... It's just an example, but in innovation, in IT, in data management, in medical research, working together. So several examples. And we are quite a recent company from an international standpoint. And we are on the learning curve of it. It's just 3 years, and we can see projects piling up progressively.
Thank you. So from an investment perspective, is the French market consolidated, or do you see more room for private equity investments?
Well, I would say that the French private hospitalization market is quite consolidated, as 2/3 of it is in the hands of 4 groups. So, but having said that, it means that you have one third which is available and which is today in the hands of small groups or small clinics or independent hospitals. So there is still room of maneuver to make some pick and choose acquisition or bolt-on acquisition in the territories where we are. Now, to be totally transparent, for Vivalto Santé, our interest is to build up in Europe and not in France.
And what are the main challenges and opportunities for private hospitals in France and in Europe more broadly?
Well, I will answer to your question not only on the global angle, but from Vivalto Santé's point of view. If we go to the key challenges, clearly in Europe, working in an environment where there are a lot of pressures on the budget on each country, you know the story. On one side, you have the aging population, you have chronic diseases, you have the progress in technologies, in pharma, which means also higher cost. On a parallel basis, you know that the resources are capped, they are limited. So clearly, you have a drastic difficulty for government to manage the situation. So it puts some pressure. This is where being in several countries is better for us, because then you can be agile from one country to the other. The second thing is about scarcity of talents, doctors, nurses. We know that we are struggling in the coming years to recruit people, and that a lot of doctors and a lot of nurses will go on retirement. So this will be a challenge also for us. And last but not least, when you are a company like us, which is a pan-European company, you have to struggle with different regulation, different rules, different habits, and it's very often very difficult to address these difficulties. Now, these are the challenges. When you look at the opportunities, clearly, what we see, and 2 days ago in HBI, we had the privilege to hear about the head of social security in France, 𝘃𝗶𝗲𝗄, and he said to a group of people, we need in France to have a strong private hospitalization system in order to challenge the public organization. And I think that it was very courageous on his side to say that, but it's a global vision that we share also with Spanish, Portuguese, Swiss authorities. They all say that they need to have private hospitalization being here to challenge and to be in the efficiency, I would say, dynamism. So we are a key pillar of the system. The second thing, which is an opportunity, to be pan-European is a way to be in a build-up situation everywhere. You can grow your base of business, which is quite interesting. And as I said before, with that, you can build upon all best practices and news that you can learn from different countries. And last but not least, we have developed a model, which is a third way model, which is a co-governance between doctors, managers, and shareholders. Doctors being on one side shareholders, but on the other side also partners, medical partners. And this, I would say, quite original model of organization is something that has shown its effectiveness in France during the last 15 years, and we are just at the beginning of implementing it in the countries where we are. We are really expecting huge progress in the future in the countries where we are implementing the same kind of system, because it's unique, it's our unique characteristic, so we strongly believe in it.
Thank you, Emmanuel.